Hey guys, it's Katie. I wanted to touch base with you because I went to the doctor today for my 7-month follow-up, and let's see, it was a little bit of a different appointment. So I'm going to give you my expectations and then I'm going to talk about reality. So my expectation was that it would go as all my other appointments had gone, which was get checked in, have the nurse take me through, get my blood pressure, weight, and normal questions answered, and then have the doctor come in, have him retrieve data from my device, and then reprogram it and send me on my way, which normally takes about 15 to 20 minutes depending on how long I'm waiting for the doctor. That was my expectation. Now, reality today consisted of getting to the doctor's office, checking in, them taking me back, talking to the nurse. That was normal. She asked me today if I minded a med student with the doctor. And normally they don't ask, so that should have thrown a red flag for me. But I'm used to having fellows follow my epileptologist around because the hospital I go to is a teaching hospital. I'm just used to it. So it really didn't bother me that they have people following my doctor around. But it was just odd that she actually asked this time. So anyway, nurse was done. I hear a knock on the door, but nobody came in. And what typically happens is a knock on the door, my doctor just comes in right after he knocks. So I didn't say anything. Well, the door doesn't open, so I'm like, come in? And a new fresh-faced med student with a white coat on walks in, introduces himself, and says that he's going to be asking me questions before my epileptologist comes in to see me. And I'm like, okay, no problem. And because he had never seen me before, and I think because this was his first time with a patient, I'm not sure what the situation was. He asked me questions for a good 30 minutes. And these were very basic, not only like epilepsy questions, but also very basic questions that I haven't gotten asked from my epileptologist since I first saw him. And I could tell he was a little nervous. He didn't get flushed like people sometimes do when they get nervous. But I could tell that his hands were shaking when he would move them around, and he was moving them around a lot. If he would, for some reason, like settle his hand down, I would notice his hand was shaking just a little bit. So I understand he's a med student. He's not used to this. So whatever, he's fine. But it took a half hour. And at that point, I didn't know when my doctor was going to come in. And he wasn't used to the structure of my typical appointments with my epileptologist. So that was understandable. The med student stepped out of the room, met with my epileptologist, discussed what their plan was, and then came back into the room. And as I was discussing with my epileptologist what the plan was going to be, the med student was standing there listening, learning what we needed to be doing, and discussing what I needed to be doing. And given the circumstances in my life recently, he suggested that I be put on a prescription for some insomnia, but only as needed. And so got to that, and then another nurse opens up a door and brings in the machine to program my device, which interrupted the conversation that we were having regarding the new med, which I wasn't too keen on, but I understand that it's kind of necessary right now, and my doctor, he's only going to allow one refill on it, and which is good. And he wants to restrict that for me to only be taken no more than 2 times a week. So it's good in that I won't become reliant on that for sleep, as well as it's also a drug that assists in controlling seizures. So got another drug prescribed to me. He also mentioned that in this appointment he wanted to get me scheduled for another 24-hour EEG, but I'm not at the level with my VNS that I should be, or that he wants me to be. And so I'm going back in a month, towards the end of August, to see him again, and he's going to be more aggressive with my machine. Now, he told me that my vagus nerve is extremely sensitive, and that's not a bad thing. That's a good thing. That means that my vagus nerve is healthy, and that the stimulation that it's receiving is not being taken lightly. So we have to be careful with how much we stimulate my nerve, because it is so sensitive, because it is healthy. But he did say that he wants to become more aggressive with it so that we can get my seizures under control. Because I'm still having, on average, 20 seizures a day. Again, it depends on the day. Some days there's 30, some days there's 10. Some days there's 5, some days there's 50. It just depends on the day and what's going on. So, and I always have to guess about how many I'm having, because I never can keep track. I've tried spreadsheets. I've tried a custom application that one of my work friends developed for me. And it helps sometimes, but I don't always have what I need with me when I need it. And then I forget to go back and log it afterwards, because they do happen so often. But long story short, at my next appointment in August, we will reevaluate when I need a 24-hour EEG, which the last time I had that was 15 months ago, almost 16 months ago, so April of last year. And yeah, after that they confirmed I actually had epilepsy. So after this one, I guess they will, I don't know what they'll do. I guess they'll compare it to the one I had last and see from that the frequency and duration of the seizures, how much that has changed since I had the last one, and since surgery, because surgery was in the middle of that, and see how much my device has affected me. I'm trying to remember if there's anything else from my appointment. I think that's it. So, around month 8, I will have another update. Until then, I guess that's it. My brain is everywhere right now. Yeah. Oh, he only changed one setting on my device, and that was the output current. He raised it on all 3 settings, the regular setting, the auto stim setting, and the magnet setting. So he raised all 3 of those. And I'm getting used to it again. As you can tell, my voice is still changing every time the device is on. It is currently on. I can do It just turned off. I tried to show you. I tried to let you listen, but it turned itself off. Because right now my voice is normal, and this is how I normally talk when my device is not off. And if I give it another 20 seconds, it will turn itself on. The device is off for 66 seconds, and then will turn on for 30 seconds. And then it'll turn off for 66 seconds, and then it will turn on again for 30 seconds. And it will continue on that until it's reprogrammed. So, it's not too bad at all. I don't know. I'm trying to wait for this to come back on. I can tell when it comes back on. Ready? I should just count. It should be on here soon. There we go. It's on. I can feel it. It's just producing weird. Now it's not vibrating my voice. I don't know what the deal is, but it's not vibrating my voice. I don't know. We'll figure it out. Anyway, thank you guys. Have a great rest of your week. Have a happy Wednesday. And I will talk to you all next month. Bye.